Have you ever wondered how doctors get good at what they do? I mean, what if they could practice for a high-stakes, life-or-death surgery before ever stepping into the operating room? Well, today we're diving into the incredible world of healthcare simulation, a place where practice truly makes perfect, without any of the real-world risk. The philosopher John Dewey really nailed it when he said that learning is all about action. And nowhere is that more true than in medicine. You just can't learn how to restart a heart or deliver a baby from a textbook. You have to actually do it. And that brings us to the core challenge, right? How in the world can you train for those critical, heart-pounding moments in a completely safe, controlled environment? Well, that is the exact problem healthcare simulation was created to solve. So, to really get a handle on the power of this approach, we first need to be super clear on what simulation actually is. And trust me, the answer might surprise you. Okay, this definition from the expert David Gaba is so important. Notice the keywords here. Simulation is a technique, not a technology. It's not just about the fancy robots or the VR goggles. It's a carefully designed method for creating these really powerful interactive learning experiences. Now, this whole push for better training didn't just pop up out of nowhere. It was really fueled by growing concerns over patient safety, which all came to a head with a huge report back in 1999 called To Err is Human. That report was a bombshell. It showed that medical errors were a leading cause of death. That created a massive, urgent call for new training methods like simulation. So we know what simulation is and why it's so desperately needed. But what's the science behind it? Why is this technique so incredibly effective for learning complex skills? Well, research shows that the most effective simulations have 5 key ingredients. For instance, immediate feedback is absolutely crucial. You need to know right then and there if what you did worked. Another one is deliberate practice. This isn't just about repeating a task over and over, but doing it with the specific goal of getting better and better. You combine those elements with reflection and just the right amount of realism, and that's what makes the learning really stick. Okay, now I know this might look a little complex at first glance, but this diagram is basically the engine that drives all of this effective learning. It's called Kolb's experiential learning cycle, and it's the framework for how we turn a single hands-on experience into deep, lasting expertise. Think of it as a continuous loop of learning. So let's break down what that loop actually looks like. Here's how that cycle works in the real world. It all starts with the concrete experience. That's the simulation itself. Then, right afterwards, you reflect on what happened during the debriefing session, which is honestly the most important part. That reflection leads to thinking, where you analyze what went right, what went wrong, and form new ideas. And finally, you close the loop by doing. You take what you've learned and apply it in the very next scenario. Experience, reflect, think, do. That's the secret sauce. All right, so what does all of this actually look like? Let's open up the simulation toolbox and check out all the different forms this can take. Man, the technology has evolved like crazy. It started pretty simply back in the 1940s with the iconic Resuscian for CPR. You've probably seen one. The 60s gave us Sim1, the first real full-body mannequin, but the real explosion happened in the 90s, which paved the way for the incredible computer-controlled mannequins we use today. These things can breathe, they can bleed, and they react just like a real patient. It's wild. So today, the toolbox is super diverse, with different tools for different jobs. For a complex medical crisis, yeah, you might use a high-tech mannequin. But for practicing something like a difficult conversation with a patient, nothing beats a standardized patient. That's a live actor who is trained to portray a specific condition. And now, of course, we have virtual reality, which can literally transport learners inside the human body in ways that used to be pure science fiction. But with all this amazing practice, how do we actually know if it's working? That brings us to a super important topic: evaluation and continuous improvement. It really all boils down to this simple but incredibly powerful idea. You just can't improve what you don't measure. Effective measurement is the key that unlocks real, meaningful improvement in any training program. Period. A classic framework for this is Kirkpatrick's 4 levels of evaluation. Think of it like climbing a ladder. You start at level 1, reaction. Did people like the training? Then you climb to level 2, learning. Did they actually learn something new? Level 3 is behavior. Are they using those new skills out on the floor? And the holy grail, level 4, is results. Did this training actually improve patient outcomes? That's the ultimate goal. So how do you get all the way up to those level 4 results? Well, you need a systematic approach. This is where quality improvement, or QI methods, come into play. Organizations like the Institute for Healthcare Improvement have these amazing toolkits filled with proven strategies to help teams figure out problems and drive real change. One of the classic tools is the cause and effect diagram, but most people just call it a fishbone diagram. So if your problem is, say, delays in the ER, a team can use this to brainstorm all the possible root causes, everything from staffing to equipment to procedures. It helps them see the whole system at once. And once you have a potential cause from your fishbone diagram, you can test a solution using a PDSA worksheet. It stands for Plan, Do, Study, Act. So let's say your diagram pointed to a communication issue. You could plan a small change, like a new handover script, do it for a day, study the results to see if it worked, and then act on what you learned. It's all about making small, smart, data-driven improvements. We've seen how professionals practice and how we measure if that practice is working. But now, let's tie it all back to the ultimate goal: improving care for real patients. This whole journey, from the simulation lab to the patient's bedside, is often called translational science, and it happens in phases. Phase T1 is just proving a concept, like showing a new technique works on a simulator. T2 is putting it into practice, where that better CPR training actually leads to more lives saved. And finally, T3 is when you make it the standard of care for everyone, like when a hospital requires all its staff to adopt that new, proven protocol. So, what are the big takeaways here? At its heart, simulation gives us a safe space to practice for the highest stakes imaginable. But its success isn't magic. It's built on solid, proven learning science. And the toolbox for this is incredibly diverse, from mannequins to virtual reality. But maybe most importantly, systematic measurement is what connects all that practice back to what truly matters: making things better for patients. And that really brings us to the future, doesn't it? Simulation has already come so far, from simple CPR dummies to entire virtual worlds. So as technology like AI and augmented reality keeps accelerating, you just have to wonder, what does the future of practice look like? What really is the next frontier for training the healers of tomorrow?